All right, Mr. Brooks came in March. He was having a problem with a root canal tooth, and we talked about doing an immediate implant and taking the tooth out. Henry, what was it like? What was it like being here? What was it like going through that process with me and getting this implant done?
Well, it was different. I was astonished on how the tooth was taken out to get down there, and when that was done, we found out why I had a root canal and it didn't take, because evidently the tooth was a little different. It's a little tail out there.
Okay, now what Henry is describing here is this molar. It's molar number 30. And he's been having a problem with this tooth off and on since it was root canaled. Didn't know why he was having this problem. He had a post, he had a core put in it, a crown put on it, and he was still having problems over the years. So he came to the office and we talked about the tooth, and I told him what was going on with it, how the infection was set up around this distal root tip. Now this is like a 90-degree hook. This is very hard for any endodontist to obturate and seal. So the infection was here. The seal was no good at the end of the root tip on account of this anatomy right here. So we decided to take the tooth out and do an implant.
And then we proceeded on and allowed it to heal up, get the pin in, and grow back before we finally got the crown on. Different than I thought it was going to be, because somebody else in the family had it done. I guess it was a little bit different way. So,
well, how was the experience getting the tooth out and working with me to get this done? Because we went through that process. Was it painful?
No.
This is the implant. This is the number 30 site. Here's the distal root with the hook in it. Now, when we took the tooth out, I sectioned it, got both the roots out, made sure I got everything out. I took a check film too, which I don't have on the video. But then I went in and modified this mesial root, which turned out to be a good candidate for a 6mm implant. Now, in the back area, 5 and 6mm is what needs to be used in this type of area for the kind of load that's on it. And here's the grafting material. I put a little bit of grafting material over the top and then sutured everything closed. We checked this implant at 1 week, 2 weeks, then 1 month, 2 months, and then a time at 3 months to make sure it's integrated. Then we uncover it to do the restoration part of it, which is putting the post in and then prepping the post, if need be, for the implant crown that goes on.
Taking the tooth out is, I've had, because I had teeth that came in the wrong way, taken out before, and that was the less painful I've ever done. In fact, the tooth was out before I realized.
And then we put the implant in. Did you have much pain afterwards?
No. They were a matter of letting it take the natural course of growing in and healing before we could go any further.
Okay, here's the tooth at 1.5 months. You can see that the graft is resorbing away. The osteoclasts are remodeling this synthetic bone graft material into natural bone. You're starting to see it disappear, starting to take on more of a natural, more trabeculated pattern. Here's the implant. We've got good osseointegration all the way around it. I still have the gum sutured up over the top. So at this point, what we do is we do the uncovering. So we split the gums over the top of the implant and put a healing cap on. The healing cap stays on for about 5 weeks. Then we get the patient back in and put the abutment in and then restore with the crown. And so what he's talking about now is it being temporized. We did have some problems with the temporary. The temporary came off, which temporaries do. They're made out of acrylic. Goes over the top of the implant after the post is put in. Not the healing cap is removed, post is put in, is prepped, then a temporary crown is put on it. And during that time, he had a little problem with the temporary crown coming off, which he came back in and we re-cemented for him.
We got it through. The first temporary, because the Novocaine, it was in there. I didn't realize that it had a little high spot. It did what temporaries do. It decided to let me know that I missed something. The second one, the glue gauge decided that was temporary, and it served its purpose. So now we got the permanent in there, and it feels like it's supposed to.
Okay, great. All right, thank you. It's great having you as a patient. Thank you for letting me use this as a testimonial. And we look forward to seeing you next time.
Yep.
All right, here's the implant at 3 months with the abutments screwed, torqued down into it at 30 Newton centimeters. The crown is permanently cemented on the top. We got good osseointegration. Here's the distal root. The distal root is the bone graft is healing in. We're starting to get, or almost 100% trabeculation pattern in there with the grafting material disappearing as the osteoclast and osteoblast remodel that. I want to thank my patient for letting me use this as a testimonial, educational, and thank you for watching. I hope you enjoyed the video.